The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we'll be interviewing Kimmy Everman, who's a program specialist with the Department of Public Health and Human Services, about all things Medicare and how Medicare is changing and adapting to the COVID-19 crisis, and what you can do to protect yourself and make sure that you and your communities are staying healthy. So make sure you stay tuned to today's Aging Horizons.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath, are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Gentlemen, this is a secure federal facility. Do you have your Montana Real IDs?
ID. I am Captain Lewis, and this is Captain Clark.
I'm sorry, I can't let you in.
Can't go into a federal facility, can't fly. Let's go back to the river.
Yes, we'll float home. Let me check the Google. What's a dam?
Discover more at mtrealid.gov.
Montana Real ID. It's the real me.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm Katie Lovell, and I'll be your host today. Today, via Zoom, we're interviewing Kimmy Everman, who's a program specialist with the Department of Public Health and Human Services. Kimmy, thanks so much for joining us today.
Hi, Katie. Thanks for having me.
So, Kimmy, I know that this challenging time, everything's been a little bit confusing about Medicare, what it's going to cover, what it's not going to cover. So I thought maybe we could start with just a general overview of Medicare.
Okay. Yeah, and let's just clarify what we're talking about is, we're in the middle of the COVID-19 pandemic, and we've got a lot on our plates out there, especially our Medicare beneficiaries wondering what it is that is going to be covered with their insurance. Yeah. So let's just talk about the basics. You have A, B, C, and D for parts of Medicare. A, of course, is your hospitalization. So if you get real sick, you need to be hospitalized overnight for many days, whatever it is, that's the part that's going to cover that for you. It's also known as major medical or catastrophic coverage. Part B is the outpatient coverage, and most Medicare beneficiaries, they know all about their Part B because they use it all the time. It's to go to the doctor, it's to have tests done, it's to, get vaccinations and immunization. It's for all the basic sort of medical needs that you might have. Then we're going to jump over C for just a minute and go with D. Part D is the drug coverage or the prescription drug coverage that Medicare offers beneficiaries. It's a voluntary program that has lots of great perks to it in terms of being able to get most of the medicines that you need at good prices. There's lots of assistance programs available so that anybody that needs that can get that. So, we love our Part D for sure for our Medicare beneficiaries. And then let's go back to Part C for a second. Part C, as in cat, is all the pieces of Medicare put together into one kind of bucket. And it's often called a Medicare Advantage plan or a Medicare Health plan. And what a Medicare Advantage or health plan does is it takes Part A, it takes Part B, and it takes Part D, and it compiles them into one insurance or coverage product that a person can have. And, let's just say that a person feels real comfortable with a system like that. Those are great programs for lots of people. Everything is kind of a one-stop shop. If you're using Part A, Part B, and Part D sort of separate, if you will, that's called the traditional Medicare model. And that just means you can go to any doctor or practitioner who accepts Medicare, any hospital that accepts Medicare. With the Part D, most of the pharmacies anymore are taking all the different plans, the Part D plans that are available. So really, there's a real wide range of access that folks can have.
Great. Kimmy,
also, along with that is if you do the Medicare, the traditional model, you might want to get a supplemental insurance. And that's probably a discussion for another day to really get into it. But that's another coverage you can get if you're using the traditional model.
Great. Kimmy, who is eligible for Medicare?
Katie, anybody that's 65 and older, also people that are disabled, that have been found disabled by Social Security criteria. And it's really important to remember that it isn't that your doctor can just say you're disabled. You have to go through the entire Social Security eligibility process. And if that happens, you get Medicare younger than 65. But for the most part, it's people age 65 and older.
And Kimmy, if you're having issues deciding what plan is right for you, if you have questions, who should you contact?
Well, hands down, you want to contact your local SHIP counselor. And I'm positive we can run that number. We have a dedicated group of greatly motivated, trained, compassionate people out there in Montana that are Medicare advocates, and they will help with whatever questions, whatever concerns. If they don't know the answer, they'll find out for you. And it's just great when you're working with something as complicated as Medicare can be to have your own one-to-one advocate, which is the SHIP counselor.
Absolutely. Kimmy, I expect that Medicare has had to make some changes, just like the rest of us has, to deal with this COVID-19 pandemic. So when we get back, I'd like to talk about what some of those changes are, what new programs are available, and what sort of benefits are available now under this new COVID-19 pandemic that we're all dealing with together.
That sounds great.
Great. Okay. Thanks, Kimmy.
think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Everman, who's a program specialist with the Department of Public Health and Human Services. Kimmy, thanks for joining us today.
Thanks for having me, Katie.
So Kimmy, let's talk a little bit about what coronavirus, COVID-19, SARS-CoV-2, what is this? What does that mean?
Well, really simply, because I'm not a doctor or a scientist, a coronavirus disease is just an infectious disease that's viral. It's a fairly new virus, and it causes respiratory illness, much like the flu, with coughing, fever, and in some really extensive cases, really a lot of difficulty breathing. Sure. I've heard that it's like flu, but so much worse. So I don't know, haven't had it, but it sounds pretty much like you want to avoid it if you can.
Absolutely. And why is this something that's more dangerous for seniors?
Well, because it spreads so quickly and so easily. For one thing, it spreads primarily through the contact of an infected person just sneezing, breathing, talking, touching a surface. At least this is what we know. And for folks that are older, 65 years and up, they're more likely to have a compromised system where maybe they have underlying illnesses like diabetes, like high blood pressure, immune deficiency kinds of things, asthma, heart conditions, just anything like that. A senior may be more apt to have an underlying situation that the COVID is going to make much worse.
And it's not just seniors, right? It's people with chronic diseases, lung diseases, people who are dealing with cancer treatments, all sorts of people, right?
Right. It isn't, you're right, it isn't just seniors. I think we tend to worry more about seniors because they can be vulnerable in so many ways, but even young folks are getting this illness, and so it's really nothing to take lightly. We want to really pay attention to everything that the information we're getting about how to protect ourselves, and really try to not get it if at all possible.
Sure. And there's some really good sites out right now. The CDC's website, the coronavirus.gov, really great websites to keep up to date.
Right. And I think any of those sites are great information, keep you up to date, keep you from getting, I know I myself get pretty worried and anxious watching the news day after day. So it's nice to have places and resources that are just very straightforward and factual. And that's what you've mentioned. Those are very good resources. Another one that I would like to mention in the state of Montana, again, because we know that this is a stressful situation for a lot of people. And Montana has what's called a warm line, and I'm sure we can put that up on the screen. The warm line is just for support from another voice if you need it. And certainly if you're having anxiety and are worried, that would be a great place to call and just get a little support.
Absolutely. And these are hard times for everyone right now, so it's okay to reach out for support.
Absolutely. And I think it's imperative that we all remember that there is going to be a light at the end of this tunnel, and we just need to do our best to hang in there and take care of each other, and absolutely take care of our seniors, our Medicare beneficiaries, because they really are very vulnerable.
Absolutely. And Kimmy, I know Medicare has been making some changes to what they're doing. Can we cover a few of those?
Sure. Well, for one thing, they want to make sure that people are using good protocol, hygiene, washing their hands. When you're getting mail and things like that, wipe it down with disinfectant cloths. Use a lot of hand sanitizer if you have it. And always, here's one I've learned since this began. Cough into the cup of your elbow, not your hand, because your hand is so much more likely to come in contact with someone else, where the cuff of your elbow, like that, is a lot safer.
Absolutely. And then just making sure you're following those social distancing, that 6 feet apart.
Absolutely. And I think the other thing with social distancing is we don't want to have big groups either. Sure. I know many folks that have had family gatherings and stuff outside with 6 feet apart so that they can still see each other, but that they're still being conscious of not spreading.
Absolutely. So making sure you're washing your hands every time you touch anything. The thing that's the hardest for me is not touching your face.
Yes, indeed.
Making sure you're staying 6 feet apart. And right now, making sure you're only going out for essentials, because we're not just protecting our seniors, we're protecting every member of our community.
Yes.
So, Kimmy, when we get back, I'd like to talk about the changes to Medicare itself. What's available, what's covered, and where people can go with questions.
All right. That sounds great.
Perfect.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Welcome to Aging Horizons. Today we're speaking with Kimmy Everman, who's a program specialist, about Medicare and the effects of COVID-19. Kimmy, I think one of the things that people are really dealing with right now is the stress related to COVID-19. I know that there are lots of things available, lots of programs. Let's talk a little bit about that.
Yeah, I think that we wouldn't maybe have guessed how stressful this is, but you're in your home, you're, cabin fever, as we might call it, and you're watching the news, or you're running out of food, or whatever the issue is, or you have a sick family member. I mean, there's so many things to feel anxious about. And some of the guidelines coming from Medicare about dealing with stress, I think are pretty good. Try not to watch the news all day. Try to take a break from watching, reading news stories and social media, and go maybe take a walk, maybe play with your dog in the backyard. Just do anything you can do that will get your mind off of the bad news for a few minutes and let your stress kind of calm down. Take care of your body. If you do yoga, if you meditate, any of those things are great for this kind of situation. But also just get enough sleep, drink enough water, and eat well. Those are all things that are going to be very important to keeping you as a person stuck in your house more, sane. I know sometimes I feel a little insane being home, but I think it's just really important that we take care of ourselves in a way that's spiritual as well as physical.
Absolutely. And then finding different ways to connect with your friends and loved ones, whether that's video conferencing or phone calls or writing letters, just making sure that you're still connecting with the people that are your support system.
Right. Because let's remember that many older adults are living alone. They don't have a lot of family around them. They may or may not have someone they feel they can count on. And I want to slip in here that this might be a great time to call one of those SHIP counselors or just call the area agency on aging for that support. Those folks are available to help beneficiaries through all of this stuff, and they realize how stressful and anxious people are feeling right now.
Absolutely. So Kimmy, let's talk a little bit about what Medicare is covering.
Okay. Yeah, I'm proud to say that there's very little change, even though this is a brand new virus. Medicare is taking care of all the testing as they would with any kind of situation where you were ill. If you're in the hospital for it, Medicare pays, just as if it were any other illness. So I want our Medicare beneficiaries to remember that this is not, as scary and strange as this is, it's not something that Medicare isn't ready to take on. I think we'll, into the future, have lots more guidance from them and the CDC and all the other folks that we look to. But I think beneficiaries, Medicare beneficiaries, can count on Medicare to be there for them through this kind of thing.
It certainly isn't a reason that people should be afraid to seek care, because Medicare is going to be there.
Absolutely. And I say, if you have any kind of question, call a SHIP counselor. They are so ready to talk with you. They so want to guide you and give you the assistance you're looking for. And as I said earlier in the show, these are folks that are well trained, but if they don't know the answer, they're going to find out for you.
Absolutely.
They won't just say, well, sorry, I don't know. They'll find out for you.
I've never heard a SHIP counselor say that.
Yeah, they're pretty wonderful people.
And Kimmy, I think one of the neatest advantages that have come out of this is the expansion of telehealth, which is now more available than ever.
Yeah, and that's, I guess, thanks for mentioning that, Katie, because that's important. Especially right now, some of the rules around that have been lessened a bit so that people can more easily access telehealth and telemedicine. And imagine being able to do that from your house and not have to go out into the cold or the, icky weather or people around you that are sick. And Medicare is proactively standing behind that and making that available to beneficiaries.
And that's so wonderful for people to know that there are other options out there to receive treatment, to get what you need from Medicare in all different sorts of ways. So Kimmy, just to go over a few overviews of today's discussion. One, Medicare is on board. Medicare knows what to do, and they are backing up those resources. So if you need to get tested, if you are needing to be hospitalized, Medicare is going to be there to help cover those benefits. And you can always reach out to a SHIP counselor if you are not understanding what Medicare covers, if you have questions about whether or not a specific test will cover. If there ever becomes a vaccine available for COVID-19, Medicare will cover that under the Part D plans. So important to know, important to be on board with. And then, as always, reach out to those SHIP counselors, because they are always there.
Yeah, those are your very best advocates for Medicare in your local community.
Kimmy, well, I really appreciate you joining us today. I know this is a whole new world, and we are doing things differently, just like the rest of the world. And I appreciate you joining us via Zoom today. So I hope you're staying safe and healthy out there.
Thanks. And I thank our audience for hanging in there with us.
Absolutely. Thank you for staying tuned to today's Aging Horizons. Well, make sure you're washing your hands and staying safe out there.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.